how are you doing? I hope you're doing great and having a wonderful day with your family. And I hope you're having great weather. That's the big topic. What's your weather? I was just listening to a podcast. I ran across Tasha K. She was talking with a podiatrist, a doctor that works on your feet. And he was talking about different reasons people come in for cosmetic podiatry. That means ways to make your foot look better. If you have fat toes that are too long, too short, they're crooked or bent in such a way that they have pain. He was talking about all the different things you could do. If you have a flat foot, if you have swollen ankles, possibly he could help. And he could give suggestions of what might be causing the problem. It was funny to me because one of the things that Tasha K wanted to talk about was when she wears flip-flops, her foot hurts. And so she wanted to know, what could this podiatrist do to make it so that she could wear a particular type of flip-flop and not have her feet hurt when she wears it. I think what happens to me with certain shoes, especially if they don't fit my feet well, is that my toes curl under in order to keep the shoe on my foot. And so as I'm walking with clenched toes. And so after a while, that causes pain, discomfort, and you don't really want to wear the shoe. So I think the biggest thing to remember about your feet, whatever your problem, is you have to have the proper shoe. The shoe has to fit properly. If you have arches, you have to have an arch in the shoe, and it can't slide off your foot. If your shoe is always trying to slide off your foot, as for some shoes that are flip-flops, your toes are going to have to do the work to keep that shoe on your foot. So your foot should be able to relax in the shoe or on the shoe as you walk. And if it's not relaxed, you are going to get discomfort somewhere on your foot just by your toes clenching up to try to stabilize that shoe. So I have a problem with that sometimes when I wear these Crocs. Certain types of Crocs don't do well, especially if I'm in my garden and I'm watering and the shoe gets wet and my foot gets slippery inside the shoe. It can be very uncomfortable, can be dangerous even with the shoe trying to fall off my foot. So main thing, make sure you have a good shoe, and if your shoe has problems, you can also get those insteps, those little things you put inside the shoe, which might provide an arch support or padding on the shoe or some other thing that you need in order to position your foot properly in the shoe. Now, what was funny to me is Tasha K was really eager. She's thinking about getting some type of assessment for possible future surgery so that she can wear these sandals. I think they were called Birkins. I'm not sure what they were. But the doctor said, well, maybe you're drinking too much wine. In other words, maybe you're having foot problems because your diet's bad. And Tasha also mentioned she gets discoloration of her toenails. Now that's very bad. That's a sure sign of diet or bad shoe or maybe some type of foot infection. So when the doctor told Tasha that she might have to change her diet, Tasha said, well, no, she's not giving up the wine. And that is so typical of people who want to go to a professional for help, but they don't want to really get the help. They don't want to really get the help that the professional is going to advise It's like the overweight lady going into the doctor to see how she can control her diabetes, and he gives her a diet and some information about what she needs to do, and then she walks out saying, I'm not going to do any of that stuff because I like this food and that food, and I'm not going to change anything in order to lose the weight, but I'll do this and that. You pick and choose. You pick and choose. And, if you don't really take the advice of the doctor, or you're not really willing to hear about it and to consider what reasoning he has behind his suggestions, you're kind of wasting your money. And, I would just accept that maybe wearing that particular sandal for Tasha K is not for her. It's just not for her. Those shoes don't fit her feet properly for whatever reason. So it was interesting to hear about her talking about all of these surgeries that this podiatrist could do. My advice is don't get any foot surgery unless it's really, really needed. Like if you have a hammer toe and it's wearing down your toes, or you have a bunion that's really in a lot of pain and it's causing a lot of problems with your wearing your shoes and so forth, and you can't fix the problem just by adjusting your shoe, then you might go for surgery. But I'll tell you, a lot of people get into big problems having foot surgery. Your foot is a very special thing on your body. It carries all of your weight all of the time. It runs. It stops suddenly. It climbs. It gets hit. Things drop on it. They have bad shoes. You have old shoes. You have dirty shoes. It gets put in muddy water. All kinds of things happen to your feet, and your feet have to be in excellent shape. And once you have a scar, if you have bad circulation, if you have some other problem with your foot, you can have skin breakdown or areas of weakness on your foot that can lead to additional problems. Now, people kind of poo-poo. They think getting foot surgery is like getting facial surgery, but not so. And you can ask Deion Sanders. He had problems with his feet. He ignored his feet. He didn't treat his feet properly. And then he had that stint where he was in, I believe it was Arkansas, and he was, with all of that dirty water in that community, and he was washing his tender, infected feet in that dirty water. You can't treat your feet like that, because your feet will find a problem sooner or later if you continue to treat them badly. So foot surgery is a big thing to consider. It should not be done lightly. If you want to have some surgery done on your face, you're probably better off than going to have surgery on your foot. Most people don't need surgery on their foot because they can accommodate with how they're dressing, changing their diet, getting rid of infections, taking better care of your feet. I'm a firm believer that people should, at least once a week, have a real good look at your feet. Are there any red marks that are coming up? Are there any areas that are becoming calloused where they might eventually have skin breakdown? Are there any places on your foot that are thinning out where eventually you're going to get an ulcer or some sort of sore? Do you have an odor on your feet which indicates bacteria or fungus or something like that? Are you airing out your feet? Your feet have to be in the air, and they have to be in the sunlight periodically just to help kill bacteria and to make sure they have an opportunity to dry out and just rest. When you rest, sometimes you need to elevate your feet. You don't always want your feet low, so you don't always want to have them at the lowest part of your body, like when you're sitting in a chair. They might not be getting the best circulation. So having an ottoman where you can prop your feet up or something like that, or pulling a second chair up to your knees so you can rest your feet on that chair. Lots of things you can do to accommodate in your life to make sure you continue to have good feet. And make sure your skin's not getting too dry on your feet. Periodically rubbing with a lotion on your feet to keep your skin supple really helps. But do have rather frequent opportunities to really take a look at your feet for anything that looks new or unusual or of concern, because you don't want to wait until it becomes a big problem, and then you risk having an even bigger problem in the future, especially if your family or you have a history of diabetes or any other health problem which might complicate the foot problem. So I was just wanting to talk about this podcast that I ran across with Tasha K. And it was funny. Tasha K's talking to this doctor, and she chooses an outfit where her breasts are all hanging out. Her dress is hanging off her shoulders. She's big earrings. And I'm thinking, who in the world does an interview dressed like this? She really looked like she was dressed improperly, but it was funny to look at. And if you do see the podcast, don't be too enthusiastic and think you're going to run off and start getting foot surgery, because you might end up really, really regretting it. That's just my thought. And what do you think about getting foot surgery? Well, take care. I'll talk to you later. Bye.